Hello, I'm Maddie Laidlaw. I'm one of two LGBTQ community liaisons for the COVID-19 response at MDH. And I would just like to say that I think that the community liaison model is incredibly effective. It is work done by the community for the community, and you really can't beat having lived experience in the team that's doing your community engagement. They can maximize personal networks, so I'm often working with my own friends and chosen family, and getting information from them, getting information back to them. I have existing relationships with a lot of the community-based organizations that we're doing work with, and so that is huge. Also, like I said, it's a direct line of communication. It's not MDH trying to figure out how to reach people. It's people who are already connected, reaching the people that need to hear our messages, and that MDH needs to hear from them. So oftentimes when we do community engagement work, if we don't know the people, it's incredibly hard to find them. But if you're working with people who already have those connections, you're not having to put in that extra legwork of recruitment, of meeting people where they're at, because people are already where they're at, if they are trusted leaders in the community. Additionally, I find it valuable because I'm able to use my position of power as a state official to have access to that insider knowledge that I wouldn't be able to give to people if I wasn't in the position of a community liaison. I could try to pull it for my own research as a state official, but being on the liaison team, we are given so much information. We are kept abreast about a lot of changes, about resources that are made available, and those are things that if I weren't in this position, I may not have direct information about, even though my personal family and friends would be asking for the information. I would say lessons learned. It is so important to have trusted members of the community doing your community engagement. They can vouch for the agency and build trust in a way that someone coming from the outside just can't. Also, it allows for a level of empathy and authentic community engagement that you just can't get if you don't have that lived experience. And then finally, I'll say that I've been amazed by how much my team, in general, the liaison team, has put so much effort into this work. They really care, super committed, go above and beyond, often doing it in their own time. It just creates an incredibly high quality of work because we all feel a sense of personal responsibility to doing this well. A challenge is that liaisons are often, because we're the outward face of MDH for a lot of folks, we are held accountable when the state government does not meet needs of our communities. And so that can be really hard because while we can take that feedback back to the MDH, while we can advocate, we can put on pressure, and we can make sure that people's voices are being heard, ultimately we're one piece of the puzzle, and we don't always get to make the call and push for the change in a way that will actually affect change. And so that can be really hard because we don't always get to make the call that a change happens or not. Personally, this has incredibly enriched my quality of work. It has made me really motivated to do well. I feel incredibly invested in the work that I'm doing, and I just love it. And I think it's really valuable to be able to use work time to support my community. And because of that, we're able to make sure that voices are truly being heard, and that the quality of work done in advocacy for our communities, we know it's high level because we're the ones that are doing that.